I am Lori Esposito Murray, President of the Committee for Economic Development of the Conference Board. Welcome to CED's Leadership in Challenging Times series, where we feature the outstanding business leaders who are the recipients of CED's Distinguished Leadership Awards for Corporate Citizenship and Business Stewardship. This year, CED is paying special tribute to business leaders who have helped our nation navigate the many challenges before us, including the pandemic, an economic recovery that provides equal opportunity for all Americans, and building a more civil and just society. Today, I have the privilege of speaking with our 2021 honoree, Karen Lynch, President and CEO, CVS Health, the number 4 company on this year's Fortune 500 list that is playing a leading role, as all Americans know, in the national response to COVID-19. Under Karen's leadership, CVS Health touches the lives of more than 100 million people. Its vaccination program alone has administered over 20 million vaccines. CVS is the highest ranking company ever to be led by a female chief executive in the 67-year history of the Fortune 500 list. Karen, welcome.
Well, Lori, thank you so much. And first and foremost, thank you for the honor. It is truly an honor to be recognized by the Committee for Economic Development. And I also want to do a shout out to the other honorees. It's a privilege and an honor to share in the recognition for all the recipients as they've managed and led through this unprecedented time. And I am extremely grateful for their vision and for their leadership as well.
Well, Karen, the privilege is all ours. And I'd like to start our discussion by stepping back and just asking for your perspective on where we are as a country. We've been in crisis before, 9/11, civil unrest, global health crises, the Great Recession. What sets this one apart? And do you think real change is actually possible?
Well, Lori, what set this apart was the pandemic didn't discriminate. It affected every person across the globe and upended nearly every aspect of everyone's life. It created huge health consequences, and it also impacted the economy, politics, jobs, education. It disrupted our ability to connect with friends, with colleagues, with loved ones. And, clearly it was unforeseen and unprecedented. And as you know, we are living in a historic time with the pandemic, and it's forcing transformational change across every industry, and particularly the healthcare industry, where it changed the way people access care. It, accelerated the digital economy. And, what we saw in healthcare was that it emphasized the importance of affordable and quality care, and particularly access to care. It changed CVS in ways that were unimaginable. And as a company, we had to pivot and we had to quickly innovate. That said, pandemics don't have a fixed end date, and the implications of COVID are still with us today. And I think they're in their infancy. I think we'll see, a major change in the way the world operates going forward because of the pandemic. But I am very confident that collectively we'll be able to rise to the occasion and make the changes that are necessary that the pandemic clearly exposed.
Well, and picking up on your point about how CVS had to pivot, what leadership tools did you use? How did you manage the pivot within CVS into the role that it is playing now, which is a leading role in the country in dealing with the pandemic?
Yeah, I never thought I'd be taking over a role in the middle of a crisis, in the middle of a major pandemic. But what we saw was this national challenge, truly required a very local and very personal solution. And our colleagues were incredible. They stepped up in ways that were unimaginable, in remarkable ways. They did so with agility, with innovation, and with resilience. They did so with purpose. We had the ability to impact people's lives through our testing and through our vaccines. And as you know, CVS was an essential company. We never shut down. We stayed open, and we were there for all Americans across, through the major ebbs and flows of this pandemic. We were able to innovate new products and services, and we brought testing and vaccines so that we could prevail against this pandemic.
Well, it's interesting because we did CED did what we call solution briefs. We did a solutions brief on the vaccine rollout. And one of the things we were calling for was the use of the local pharmacies for exactly the reasons you said, because it really touched people's lives personally in their communities and locally.
Well, thank you for that.
Yes, I was going to say, and you managed to actually implement it. So that's fantastic. And, today the problem is shifting because we've been so successful in the vaccine rollout, and now we're dealing with vaccine hesitancy. How are you addressing this ongoing challenge?
Yeah, it is a major challenge in front of us. And first and foremost, we have to inform. We have to engage, and we have to educate, and we're doing that through our marketing campaigns, and particularly through community partnerships. We launched very early on a community-based strategy for proactive patient outreach, and we believe that I talk about this all the time, that healthcare is local. And, we really need to be in the communities to impact the way people think about health in the communities. I would also say it's more than just hesitancy. It's also access, and it's access in underrepresented communities. And that continues to remain a challenge for us. And we are partnering very closely with community organizations like the YMCA. We're also using mobile vaccination vans to stage community-based efforts. And we also partnered with Lyft, that they were providing and continue to provide free or discounted rides to our vaccination sites. And, what I would say is, and you said this, local solutions will obviously lead to have a lasting impact.
And access to affordable healthcare, that's one of your top priorities overall. And so what lessons are you taking from the access that you're trying to deliver on vaccines to a broader strategy on access to affordable healthcare?
As we've been thinking about this, COVID, it didn't create sort of the divide or the access. It really magnified the issues relative to health and relative to access. And it really shined the light on the importance of face-to-face and that local access to care. So we've been very focused on making sure that, we're educating people in the communities. As you know, we have 10,000 local health destinations. We're combining that with our digital technology for access. We're leveraging telehealth capabilities. We've expanded our telehealth capabilities in our retail locations. And outreach to these communities was the cornerstone behind the testing and vaccines. And, our health hubs are another powerful example of how we're increasing access. And I've talked a lot about this over the course of the last several months. Mental health is collateral damage of the pandemic. We've actually been putting local licensed social workers in our health hubs and in our retail locations so that people have access to the mental health resources that they might not have ever thought that would be so close to their local communities. I'm really excited about what we're seeing there as well.
And you've also undertaken a number of other initiatives in terms of corporate social responsibility that I really hope you'll share with us. They're very impressive.
Well, thank you for that. Without question, as we've been thinking about our bold goals for corporate social responsibility, we know that there's that intrinsic connection between the health of our communities and our personal health. And as a leading corporation, we're accepting that, and we're accepting that challenge. And what we've done at the beginning of the decade, we reinforced our commitment through what we're calling Transform Health 2030. And we are very focused on improving the health of people in the communities that we serve. And we are investing significantly in healthy communities. We've made a commitment that over the next 10 years, that we'll invest $1.5 billion in social impact investments to build those healthier communities. I've talked about this in the past as well. We will be introducing a new concept called healthy zones, where we will take some of the investments that we've made in our affordable housing and then wrap services around those housing facilities so that people have access to broader health. So we'll do screenings, we'll do job review, help people with job applications and resume writing. So we're really trying to focus on those health zones and really improving health access, because we all know that if you aren't focused, you're not going to focus on your health if you're worried about where you're living or you're worried about your job. And having said that, we are extending our corporate social responsibility to building out a healthier planet. And over the next 10 years, we've said we'll reduce our environmental impacts by at least 50% through strategic initiatives across our enterprise. So lots of going on relative to what we see is a major role we should play here.
And then when you're looking at the role of the CEO, which is now on social issues, which really now is being very sharply debated in our country, what do you think the role should be, and how do you determine your priorities?
Well, first, now more than ever, and we all know this, that consumer expect brands like ours to step up and lend their influence to social and environmental issues. And quite frankly, our employees are expecting the same. So, I firmly believe that companies and leaders have to rise to the occasion. As I just mentioned, we've laid out these bold goals for 2020, for 2030, and we'll continue to invest in communities. And we've made significant investments in social justice and equity. We've made a $600 million commitment to focus on job creation, supplier diversity, and the list of challenges is long. And what I always say is that we have the responsibility to lean in to them and not look away.
That's really interesting. Looking at the current crisis, the crisis management you've been involved in, and both looking at the next phase, which is hopefully the next normal, and then potentially, future crises. What are the most important leadership lessons that you can share as we emerge from the pandemic?
The first thing I would say is authenticity. Every leader, goes through difficult times, and when times are tough, I think people look for that authenticity. And one of the things I learned throughout the entire pandemic was just creating sort of somewhat of that vulnerability. And I think that, we're all people, and, people were having issues, and the fact that we are addressing them is really important. And I would say opening myself up both humbled me and energized me as employees were reaching out and, talking about and having talk about their stories, because we made it real. And we talked about the issues up front. We talked about what we knew, what we didn't know, and how we were going to work together to solve them. I would say the other thing I learned was that give leaders the latitude to lead. When you're in crisis, you have to make quick decisions. You have to keep moving. But, my perspective is let leaders lead even when you're not in a crisis. And I learned, and I knew this because I'm a big communicator, but I learned that, the importance of two-way communications, and, that was incredible. And I hope that, leaders, take the learnings from the pandemic, authenticity and vulnerability and communication and leading through change through, after the pandemic, and take that as part of their leadership going forward.
So Karen, you're clearly a purpose and values driven leader. And who would you say were the most important leadership role models for you?
Well, I'd start with family forms you, right? And I was raised by my aunt, who was clearly my role model and the strongest person I ever knew. She didn't let anything get in her way. And she really did instill resilience and, having a positive attitude. And one of the things that she always said to me was, don't let your past, define who you are in the future. And I think that was an important, advice and counsel from her, and, a clear value and important. And I think that, she was a strong woman, and I learned a lot from her. I'd also say that, I think that as I think about that role model, one of the things that she taught me was that you need to benefit from recognizing that you may not always know the answers. And one of the things that I do is I have a reverse mentor. I have a young woman who's recently out of college that, gives me advice and tells me things about the company, about what the millennials and the next generation are thinking about. And as a matter of fact, one day she said to me, we should really think about TikTok and using TikTok. And I was like, what? And interestingly enough, our marketing team, as we were rolling out vaccinations, our first big campaign was, on TikTok, and we had over 2 billion views. So what I would say is, as a role model, as someone who does, kind of takes my role seriously in helping others, be accepting and open to what you don't know. It empowers you.
Reverse role model, that's really fascinating. And especially in this crisis where we are and how important millennials are in terms of actually getting vaccinated.
Exactly.
That's a really fascinating idea. I'm doing a note to self.
I've learned a lot, Lori, and it's really good. And I don't have children, so it gives me a whole different perspective, and it gives me a perspective of the next generation workforce and how we need to learn to lead differently. And it's been terrific for me.
That's really incredible. Well, Karen, thank you so much for joining us today. And this has been so insightful in terms of really being able to spend some time with you and hear how you led such an important and such a large company through this crisis and how you're leading forward. And it is our privilege to be honoring you this year, and we're very much looking forward to the celebration in October. So thank you, our privilege, and we will see you soon.
Thank you, Lori.